Hello, dear Discus lover. Yes, you selected this video because you like to learn something about the problems that you can have with your discus fish and how to solve it. So I presented several videos on diseases of discus that I encountered during my work as a fish doctor. And today it's about a discus with holes in the head and a bacterial and a parasitic infection. So I show you my PowerPoint that shows you also the fish in the aquarium and also how I could find certain issues when using my microscope. Here the discus with head and lateral line syndrome or hole in the head syndrome with a parasitic and a bacterial infection. You can find details on fish diseases, yes, in several languages in my books which are available. The link is here below. And here the discus with small holes in the head. Not much you can see, but there are a few if you watch very carefully. They're very tiny ones here in front of the nose, the side of the gill cover, and above the head a few. That's how it starts and can get worse if you don't take action. Here you see it on a photograph. You see the abnormal formations. Here some patches appearing on this discus. Here another photograph of that discus with the small holes in the head. That's where you have to start looking and trying to find out what is wrong with the fish. And we check the internal organs quite often in discus. It's a common problem that's the start usually of some pathological issues that can help us to identify what's going on. And we could see that parts of the intestine were blocked. And that's not normal. It should be normally well spread excrements. But you see the blockage here and how large the gut is extended. It should be smoothly and normal appearance. It isn't. Inside we found in the spleen and the liver some melano-macrophage centers. You can see here the formations. And here we found internally a massive bacteria infection. You can see the massive bacteria which are moving around if you look very close. And you also see a few flagellates, parasites, like here, moving around between the bacteria. So bacteria and parasites we could find in that, well, part of the intestine we took for examination. Another part of the intestine, we could find more parasites and also quite a quantity or large quantity of bacteria. And here you see the few parasites, a kind of flagellates. It doesn't look clearly like a spironucleus, but you have spironucleus in different formats I've seen in my studies, in my work I do. And here we see more of those flagellates, which look like spironucleus. And also we see quite a few bacteria. Of course, these are all troubling the fish and can cause a disease. And that's why you have to check different parts of the intestine, because some parts show hardly anything and other parts show a massive amount of parasites, which you might have overlooked if you haven't taken an examination of the total gut. So our treatment, well, we have to define that the discus show different symptoms, and some had more holes than others. And we found a mix of internal problems, like flagellated parasites and a bacterial infection. And some had it very light and some had it advanced. But it means that the ones who have it light might develop later on more advanced stages. So you have to act to save the whole group of discus you might have. We recommend an antibacterial medication and use of metronidazole at a correct dosage. Ask your fish doctor for help and assistance to get the correct medications. And at the same time, a functional fish food can help your fish, and we recommend for that Dr. BASSLEER BIOFISH FOOD LAPACHO. So more information is available in my books, which I have available in different languages. Try to subscribe so you learn more about fish diseases and how you can try to solve them or to diagnose them. And you can get a special training at my fish doctoring at Patreon. So thank you for watching. about this discus problem. Yes, important to use a microscope like I always try to recommend at the ones who want to be specialized. Thank you for watching.